Subscribe to Dr. Madam now for valuable, practical, and easy to understand health and wellness tips to stay informed. In the middle of the night, your little child suddenly starts crying. They're holding the side of their ear tightly with one hand. Or imagine you yourself are lying down, feeling a deep, throbbing pain inside your ear. The pain is so intense that you can't sleep or stay calm. That's how earaches are. Even if they're small, the sensation feels huge. Today, in simple language, we'll gradually understand why earaches happen, how long they last, how to manage them at home, and when you absolutely need to seek help. This script was written and medically reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist and diabetes and hormone expert. Information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel to get science-based, doctor-reviewed health videos in simple language, which will help you understand your body better every day. What is an earache and why does it hurt so much? An earache means feeling pain inside or around the ear. This pain can occur in one ear or in both ears. Sometimes the pain is sharp, sometimes it throbs, and sometimes it feels like pressure inside the ear. Earaches are especially common in young children. The inside of the ear is very small and sensitive, so even a little swelling can cause a lot of pain. Imagine a little boy. Let's call him Daniel. A few days ago he had a mild cold. Today he's restless. He keeps touching his ear again and again. He's not eating. This discomfort is actually an earache. How long does an earache usually last? How long an earache lasts depends entirely on its cause. In children, most of the time, earaches are caused by ear infections. Usually, this kind of pain starts to improve within 2 to 3 days. The pain is more intense at first, then gradually eases. Often, the body heals itself without any antibiotics, so there's no need to panic at the beginning. Symptoms of earache in children and infants. Young children can't express pain properly. They show it through their behavior, repeatedly touching or pulling at their ear, not responding to calls as before, having a fever of 38 degrees Celsius, 100.4 degrees Fahrenheit, or higher, excessive crying, irritability, restlessness, loss of appetite or refusing to eat, and suddenly losing balance and falling. Imagine a little girl, let's call her Emma. She keeps falling while walking. Even when her favorite food is offered, she turns her face away. These are the silent but important signs of an earache. Home remedies to relieve earache. Most earaches get better on their own, but it's never right to endure pain. Paracetamol and ibuprofen help reduce pain and fever. Never give aspirin to any child under 16. A clean, warm cloth or towel on the ear. Gently placing a warm, damp cloth on top of the affected area can often provide soothing relief. Furthermore, ensuring that you get adequate rest and proper personal care is very important for your recovery. Quite often, these small measures are actually the best possible treatment for your condition. However, there are certain specific things that you should absolutely never do when you are experiencing an earache. For instance, you must never insert cotton buds, small sticks, or anything else into the ear canal in an attempt to clean it, as doing this can cause harm to your hearing. How can a pharmacist help? Often, pharmacists can provide initial assistance. They can explain ways to reduce the pain. If it becomes necessary, please use the appropriate eardrops and make sure to see a qualified doctor whenever it is needed. However, if you experience repeated episodes of ear pain, if the pain subsides and then returns later, or if you have significant difficulty hearing for a long period of time, these specific situations should definitely not be ignored. Immediate medical treatment is absolutely essential if there is any discharge or pus coming from the ear, sudden hearing loss, something stuck deep in the ear, or if a young child under 2 years old has pain in both ears. In these specific cases, not delaying your visit to the clinic is the safest decision you can make. Common causes of ear pain often include ear infections, dental problems or recent tooth extraction, excessive earwax buildup, glue ear, where fluid accumulates inside the ear, throat pain or tonsil infection, and various viral illnesses. For parents and older adults alike, this is meant to be a very reassuring and helpful message. Ear pain is a very common problem. In most cases, it is not a serious issue. Timely care and observation are the main treatments. Do not ignore your own symptoms. The comprehensive content of this video script was meticulously researched, drafted, and authored, and has since undergone a thorough medical review process conducted by a qualified medical doctor to ensure clinical accuracy, providing viewers with reliable and evidence-based health information that adheres to the highest standards of medical integrity and professional oversight. Shreyashi Chatterjee, MRCP UK, Medicine Specialist, Diabetes and Hormone Specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other reliable medical sources. If you find this video helpful,